Hi everyone, welcome to researchmd.com. Another great presentation, another clinical question. So does statin use, can they cause like diabetes? If you look at statin, right, the number one prescribed drug in in the world, okay? Again, my name is Pramil. Cheriyath. I'm a program director, internal medicine residency, transitional residency. I teach medical student residents on a regular basis. I'm a director of research. I'm also an assistant professor of medicine, two major medical schools. So let's look at it. Let's talk a little bit about statin. There's, again, the number one prescribed drug in the world. A lot of implications. The people who had like coronary artery disease, even like stroke, and all of this, like studies have shown like tremendous benefit. But we also try to look at it like, is there any complication associated with taking some of this drug? There is some information, like, some studies have shown maybe it's associated with the diabetes. So that's the main question. So we did some literature search. We looked at a scientific study, and this is a meta-analysis of observational studies published in the Nutrition, Metabolism, and the Cardiovascular Disease. So the objective of the study to evaluate the association between statin and the risk of new onset diabetes, okay? So when you look at the method, it's a meta-analysis. That means, they have a lot of studies, and they took it, pulled together, did a meta-analysis, very strong. It's not a randomized control, but still observational studies, large number of people. When you have an observational study, I think the advantage is usually have a huge number of people. So it's a pretty good study when you do a meta-analysis of the observational studies, okay? So what did they find? New onset diabetes risk higher in statin users, non-users. So they compared the users on one side, users of statin, and who does not use statin, what did they find? The people use statin, there's like 44% chance increased risk of having new onset diabetes. Big risk, right? So if we look at they also looked at the classes of statin. There's like, when you look at the statin, there's hydrophilic statin and lipophilic statins and all that. Rovastatin, unfortunately, which is like hydrophilic, the risk is extremely high. It can go up to 61%, right? So, but if you look at simvastatin, probably the lowest, maybe like 38%. So it kind of varies. So the bottom line, statins can cause diabetes, okay? So you got a nice forest plot over here, looking at the diagram. Did not touch, and it's on the right side. So we also compare like different statin, and all of them have significant effect of causing new onset diabetes. So in conclusion, based on this meta-analysis of the observational studies, we can clearly say there is evidence that statin can cause new onset diabetes. Okay, thank you so much for watching us. We'll be back with another presentation soon. Please subscribe to our channel.